We were in the middle of our second PCS, so second change of station in 3 years, which was quite isolating for me. And I was struggling a lot with my mental health. I was struggling a lot with suicidal ideation, just isolation quite a bit. And it really took a toll on me, having to move in quick succession with my partner not really being present. I kept saying, I know that if I'm having a really hard time with this transition, I know that there are a lot of military families out there who are having a way worse time, who don't have the support that I have, that don't have the resources, that didn't do intensive therapy in their 20s like I did. And I thought, there's a big gap here that needs to be filled, and I think Charlie Health is the perfect solution to that problem. And so it was really just me trying to figure out, where do we fit? What are the gaps in care? How can we provide, the most high quality care to our service members and their families? And it's been a long journey, and now we're in this phase of growth and taking what I've built and translating it now to my outreach team, who's amazing. They all lead by passion, they lead by example, they're all military affiliated individuals. One of my referral sources, she immediately wanted her kid to be in the program. And they went through the program, they did family therapy every week, and she texted me afterwards and she said, Ruby, it was really amazing to have a primary therapist who was military affiliated. I don't think that my son would have done as well as he did if we didn't have family therapy, because we've never had that before, but we got to do it with a therapist who understood kind of our nuanced lifestyle and the things that were really affecting his quality of life. And I know I've had military kiddos who've got to be with one or two other military kids who get to say, like, just like with anything else, right? I'm not alone. I'm not the only one experiencing that. Our service members, if one area is faltering, they're all faltering, right? And so when you have a military kiddo who goes through programming like ours, and they're doing family therapy, and the kid's doing better, that service member is able to perform better in their duties. They feel more confident going into work. I think, like with anything, the impact is much more vast than we think it is, and I think that also really accounts for our military community.